low vision transportation, transportation to and from the senior center, program and services changes for the year of 2013, and the great room transportation program and enhancements. Hey, Patty.
Okay, I have a couple of hands. One is the mission statement for the Council on Aging, which was developed and has been revised over the years. The other is just a calendar of our, we produce the calendar every month. John, I don't know if you have copies of June. July's not available yet. But we produce that as well as Elder Vision newspaper. But this is on a monthly basis because we keep adding things beyond when the newspaper's been printed.
And what we'll do, Patty, Bill will also give these to Mary Medora, and she usually copies them and puts them in pencil packets.
You need another copy just for here?
No, this will be fine.
So one of the things I wanted to talk about was transportation, because that has been one of the weaker parts of our program at the senior center. So medical transportation we've been doing for about 3 years now, and it began with a grant that we received from Cooley Dickinson Hospital in Healthy Communities. That grant has since run out, but the way that the program operates for medical transportation is we solicited for volunteers, and it's volunteers who use their personal vehicles to take seniors to medical appointments. And those medical appointments can be local. They've been to Worcester, to Boston, and the payment for it is that the senior will pay for, like let's say it's somewhere in Northampton, it's $5, and then that is, stipend is paid to the driver. We go through the city auditor in order to pay, so it's all through those types of the bill warrants. So we provide a lot of medical transportation because that's one of the biggest needs thus far. And again, it's run with volunteers. It's volunteers who are trained, who are quarried, who are given orientations when necessary, and of course they have to have a good driver's record in order to provide transportation. And we actually are in the process of upgrading the medical transportation. I mean, we always look at our programs and how can we enhance it? What do we need to do differently to, provide a better opportunity for people?
Patty, could I just ask you a question? The drivers use their own personal vehicles, correct?
Yes.
Now, what happens if there's an accident?
They are first covered under their own insurance policy and then under the city policy. Any volunteer who's doing anything beyond even medical transportation are covered under the city, the umbrella policy.
Okay, thank you.
Even if they collect the $5?
Right, the $5 is paying for like the gas, and then they receive a stipend. Yeah, it's not like they're getting paid for the job, they're getting paid for the gas, actually, is what it is. Which, of course, we all know the price of gas, $5 doesn't quite do it if someone's going from Northampton up to the VA hospital, probably back. And the nice thing with the medical transportation is somebody actually is with them the whole time. So, they're in a doctor's office and they're with the person. We also have provided a reduction. There are a sliding scale fee for people with the transportation for medical needs. Although we're looking at that because we aren't making enough money in it to pay for the program. So some of those which get 75% off, it's probably going to be 10% because we don't have the grant anymore. And yeah, we're always looking for grant money to fill the needs.
Excuse me. Yep. When did that grant end?
I think we ran out of money either the end of last year or the beginning of this year. That grant money pays for whatever, obviously the 75% that a senior receives. So let's say the transportation came up to $50, they might only be paying $15. And then also the person who coordinates the transportation for medical is also part of her salary is paid from that.
Is that the OAA?
No, that's Department of Elder Affairs.
Okay.
No, that pays for basic salaries at the senior center.
And is that grant no longer available?
No, that grant is in the process of reapplying.
Okay. Thank you.
Low vision transportation, we have a group of, individuals who, we have a low vision group, and it can range anytime from 8 people to 18 people, and we get reimbursed from the Mass Association for the Blind with that, and we usually try to find a volunteer van driver, so they basically pay for what it costs for the mileage. And then also, what we're starting, and I have to compliment Highland Valley Elder Services because we received 2 grants from them for transportation. And this is like one of the bigger parts it's starting, and it's getting people to and from the senior center. Because there are a lot of people who pay PDTA, and the PDTA is a very good source for public transportation. We are trying to get more people who lack transportation to and from the senior center. So with the grant money right now, it's $7,000 from Highland Valley that we will use, and we anticipate the 2nd of July that it starts. We're in the process of hiring van drivers. And so what that money will pay from the grant from Highland Valley Elder Services is for gas and for some of the van driver salaries. And we look forward to it really being a very prosperous beginning for us for transportation. And we do have 2 vans. One is a handicap lift van that seats 11 if there's no wheelchairs in the van. And then we have a caravan that was donated a number of years ago that we can fit 7 people in.
What year is that one from?
The chairlift van is a 1999, and the caravan is a 2006, maybe 2007. I can check that so it will be accurate.
So you don't have 2 vans, you have 2 vehicles, 1 van?
We have 2 vans. One is like a real handicap equipped van.
Okay.
The other
Where
one
the door
is just,
comes down and
yeah,
they
with the
can,
lift comes down. The other is a caravan that any family might own. Yeah, yeah. So that's nice when you only have a few people that you need to pick up, and in terms of gas mileage, it's much better.
that's great.
And just in terms of the medical transportation, if there's someone who is in a wheelchair, and obviously, a vehicle, personal vehicle, you can't get the wheelchair person in there, we would use the van with the lift. Then programs and services, we're always adding new programs, evaluating what we're doing. We just did a survey that was put in Elder Vision newspaper, and we also have copies available at the senior center to find out what people are interested in, where they got their information, and one of the questions was if you aren't using the services of the senior center, why not? And most people said it's because you're too busy, which I think is a good point. And they typically know what we're doing, but they don't need to act on it. Some people who are 85 don't think that they're old enough to need services from us or to take an opportunity, yet you have people who are 50 years old who would love to be able to be a bigger part of the senior center. And again, we are there for 60 and older from Northampton, but we also have programs for people who are 55 to 59 as well from other communities.
59 and over or 55?
55 to 59. And so there are going to be some changes at the senior center. Our bistro, which is open Wednesday, Thursday, and Friday, is going to be closing as of June 30th, because of the amount of money that it isn't making. It was there to bring in money for our costs of the senior center, but also to provide some kind of meal if people were in the building those 3 days. So in September, what we think we're going to do is switch to the coffee shop and offer soup, salads, and just keep it a little low key, and probably do as well. And I still have a number of volunteers who are interested in pursuing that for us.
That's a good direction.
The fitness center, which you all may recall, there was a kind of a difficult time for people when we switched from 2 fitness coordinators, 1 in the morning, 1 in the afternoon, to taking that away because it was not cost effective. We are, again, like the fitness center Center. We're not trying to make money on it, we're trying to provide a good program, and fitness is one of the biggest needs and interests by seniors. So the fitness center, you know, July of 2011 is when we switched the model, and back then there could have been an average of 40 participants who were paying $30 a month. Now we have 109 participants, and it's $10 a month. So it has really widened up the number of people who can use it, and it's really great to see people in there.
So you have people that actually use the fitness center as, not physical therapy, but as a maintenance program, is that?
You mean people who might have need of physical therapy?
Well, people that have had physical therapy, and then when that particular insurance or whatever it is runs out, then they can continue with, is that what, pretty much what the design is now, the program design?
No, but no, it's not. It's designed for anybody who wants to come in and use the fitness center to maintain their health and fitness. But there are people, and I do welcome the opportunity from physicians who all know what we're doing because they have to sign off on sheets. If anybody wants to come in to use the fitness center, that a number of them have been in rehab and now are following up by using the fitness center. So,
That's what I was getting at, yeah.
Yeah, but it isn't intended, like we aren't a rehab center. If people are coming to use that to maintain their stability, then we're glad that they have looked at the Northampton Senior Center to do that.
Looking at the application, it actually states if you're under a doctor's care, to get permission from the doctor of what type of machinery can you use and cannot use, and what your limits are, correct?
Yeah, the doctors have to sign off on anybody coming in to use the fitness center.
And the age group is?
It can be 55 to 103.
Okay. I'll look us up 103.
Well, the oldest person having their fitness is 103.
I think I'm right. I don't know.
And so, you know, we're thrilled that it up both financially and this has opened it up for more people, which is great. We have My Senior Center, which you all have heard about, the new software program coming in. The contracts have been signed. We hope to be trained for that the end of July, beginning of August, and to have that up and running by September. And it's just going to be a great asset, and we'll be able to provide all of you with these great statistics, which we're going to be excited about as well. Just as it's a good tracking system.
And what does that actually do now, Patty? What will you have on there? Like everything that's occurring or feedback?
When people come into the building, they'll have a little scan card that instead of them having to sign in, they'll scan it in, punch in what they're coming in for. And it's an automatic record of who's in the building and what you're doing. So at the end of the day, you can say, you know, by pressing a button, this many people use and who they were using the fitness center, the low impact, the games room for pool, or whatever the activity is.
Now, say they just come in and they use the front room just to sit down, which I've seen people sitting there and reading. So they would have to do the same.
Yeah, they would scan in and then press that you're in the lobby. So you can just enter anything we need in there. I think one of the nicest features will be that we're going to get medical history from individuals with their pictures. So if anything happens in the center, we will know who your next of kin or whoever the next contact is for an emergency, as well as a picture. Because we've had instances where, you know, the families are looking for that senior and where are they in the community or where are they? And sometimes we never had a picture, so now we would.
And actually, with the picture, you also will know what is wrong with them?
Right, it'll be in the database.
Oh, okay.
Yeah, so it's like, let's say, Smith needs, they can't find them, and so we can pull up a picture and we can assist in an emergency situation.
That's good.
I like the phrase contact person more than next of kin.
Well, I think I contact.
Just throwing that out there.
Rather than next of kin, I think it's just the first thing.
Yeah.
So it'd be an emergency contact.
Right.
And then for the great room enhancement, the great room is our biggest room in the senior center, and we've been very fortunate because a lot of what we do is based on what we get for donations. And Frank and Susan Netto, some of you may know those two. They're Mary and Frank Netto. Mary's one of our biggest volunteers. Her husband passed away son and his wife Susan are paying for all the enhancements in the great room for the acoustics. There are going to be 4 new speakers in there for better sound. There's going to be a not a slide projector, but a projector in the ceiling now that will be on that wonderful, great screen that we have that Morris School donated the money for. And we'll also have a laptop and a CD DVD player. So when people come in to use our center, or we're showing, let's say, the movie of the month, we have the big screen with a projector right from the ceiling, rather than, similar to what you have here in the council chambers, rather than us setting a projector and now it's balanced up on something and showing on the screen. And it's, instead of the wide screen that we have for the TV, it will be on the bigger screen. So the room will be far better for anything that we're going to be doing in there. Yeah, and it was very generous of Frank and Sue to do this in honor of their parents or
Theater
mother-in-law.
experience.
Yeah,
Right.
to get some stadium seating in there.
The IMAX theater
There you go.
with 3D options. It's right side.
We actually do have a movie license because we can't show any videos either on any of the bus trips or in the center if we don't have that license.
So your performance, I was gonna ask about that, your performance rights license that allows you to show, yeah.
We're absolutely careful about that.
So you can't have videos in it?
You can't show videos without permission from the studios and paying a fee. It's a common mistake that a lot of people have. They show videos that they rent from a place to a number of people, and that actually is a violation of fair use laws. So
We could never charge anyone to come in and watch the movie. People can give us a donation, or they can pay for popcorn, or whatever might be provided, but we could never charge for them to come in and watch the movie.
Okay.
No, one question for you on that. The bistro, is closing June 30th? And how much short was it?
It wasn't losing money, but it wasn't making enough money because of the amount of work and the incidentals that it took to run that.
So would you have a percentage of how much more it would have to, how much more business you'd have to have to?
I can do it.
I'm really curious, I'm just
Yeah.
kind of wondering. It's a beautiful facility, and it escapes me how it's done.
Well, a lot of people, as much as we advertise and all the ways that we do it, people kept saying, well, is it just for seniors? And no, it's open to the public. And I think we've come down to the point that we're not in the food service business. That we've gone back to looking at the mission and why are we there and what should we be providing, and it really direct services and programs to seniors.
Exactly my point. People have asked me if it's just for, they say it's just for seniors. It's not, it's open to the public.
Yeah, and I don't know what more we could have done to get people to know about it. So the energy will go into other types of programs, and then looking at, again, what we could do in the coffee shops to still provide some food. And what it does, it'll open the bistro, the dining room up for other kinds of program opportunities.
And then you have so many people, Barbara Rowley, all of them, Mary Netto, all of them in there, trying to make a goal out of it, and it's not an easy one.
No, and you can see 44 people at a time, and if we had at least 23 people every Wednesday, Thursday, Friday, we could have done better. But for the amount of money that it was bringing in, and again, it wasn't losing money, if there were more people in there, we probably could have looked at it differently. But again, getting back to the mission that we're really not in the food service business.
I think it's a good direction going right into the coffee shop. It's almost like the Collegiate. Yes, it's a different entity, but now they're even serving like full meals now in the coffee shop.
So we're looking at a number of things, and I don't think we stand still. And if anything, we should always be looking at everything. What can we offer? What are the opportunities? And can it work? And if it does, great. If it doesn't, then you move on to a different one.
It's like anything. But apparently with the exercises and the machines, it's showing you that the cost at that point was what, 100, what did you say, 100 and so much a month? And then it was dropped down on the price of how much a month? $10 a month? And you're getting how many people?
And it's a wider variety
So it's showing you that people are looking at cost. That's a big jump.
The other thing I will mention too is from Highland Valley, we received a grant, and we have for a number of years, for our low impact exercises, and just showing where our interests are. That program started off with doing, that low impact class twice a week, and we've expanded it to 3 times a week.
Any other questions for Patty?
No.
Okay, I want to also thank John for being here, and I know you're the executive director of Highland Valley, and you're going to give us an update also of Highland Valley.
I just got one of our yellow brochures. Highland Valley is federally and state funded. Our program is funded primarily by the Fed, primarily by the state. I'll just run through them quickly. One of our most visible programs is, of course, our Meals on Wheels program. That's primarily federally funded. We serve about 170 meals per day in Northampton, 250 days a year, Monday through Friday. We only missed one day this year, just so you know. And so that allows elders who do not have a regular, secure form of nutrition to have that hot meal and get visited by someone every single day. And to make sure that they're well, make sure they're okay, and they're eating their meal. And it's great assistance to them, but also great assistance to many of the families that they're cared for by. As Patty mentioned, generously, we appreciate the PR that we do have a grants program that's funded with federal dollars. We do about 25 to 30 grants a year to many councils on aging, individuals, partners, to allow them to provide services to elders in, not just in Northampton, but in we serve 24 communities in Western Mass, and it allows activities in all 24 of those communities that maybe wouldn't be allowed or be provided any other way. We fund a lot of newsletters in small hill towns that, maybe that's the only way that elders know what's going on. We provide exercise programs like we do in Northampton, but also out in Chesterfield or in Huntington or down in Blandford. So those grants really help kind of fill some of the gaps that, funding what doesn't come from either a community or a municipality or the state or the feds and so on. So we do those grants every year, and it's really been a nice program that we've done for about 10 years, including the ones that we've done with Northampton.
Could I just
Sure.
ask you a question, please? Say that you have somebody that the age limit, Patty was saying, was 55 and up
Yes.
to use the exercising machines. Say somebody was disabled in a wheelchair, okay, but can use their legs, but to a certain extent. Okay, and they don't have very much money. Does the grant cover somebody where they could go in and like exercise their arms and stuff?
That would depend on what they ask for the money. We don't determine what the money's used for, only by what the individuals or agencies have asked for. I think this year you have the transportation ones and the low impact exercise, and we've supported those in the past. So we don't determine what the money's used for. It's only what we get asked, and then it's evaluated by the community advisory panel, and evaluated to see about the funding. So that would be something with the agency that we're giving the money to. Not, we're not the direct provider. It's the individual agencies, whether it's a COA or whoever.
So say if they're 55, but they don't have that much income to pay that $10 a month. I mean, we know some don't have it. So would they qualify to be able to use that? Would you give the $10 for them if they're disabled, but they need to strengthen up their arms and stuff?
I understand the need for a disabled person who might need to use that when they're 55, but we are funding the people who are 60 and older. So somebody would have to pay the $10 or figure out a way to find $10 for them.
Okay, so it's gotta be 60.
For most things, especially if it's financial, it's 60.
Refresh my memory on, we lost some bus service or something, or cab service to the hill towns. Did that ever, it was, or it was money, it was fare-based, we were raising the fare for transportation. Was it through PBTA?
Yeah, we had that public hearing here. PBTA was going to raise their prices, which go in effect July 1st.
Oh, right, yeah.
Did they go up on you?
The last, I had a conversation with one of the members.
Because we haven't heard anything of committee.
And they, when I had talked to them, it was probably 2 weeks ago, they hadn't voted yet. So,
Well, let's
You know,
see.
they also have their own funding.
they have to be, right, you know, transportation, other than healthcare, transportation is the biggest financial burden of the agency.
Yeah.
Right, our room was packed, and there was a huge outcry out there because the amount of the increase. Some people, right now, we have some in our room who work full-time, for agencies here in Northampton, and live in Ward 6. And how much was it gonna cost them a week? $75?
It was incredible what
It
they
was
did.
huge.
When they live further away from the center.
Exactly. That's a lot of money coming out of a paycheck.
I didn't mean to get off track, I was just, but that was, just kept coming to my head, and I kept looking at transportation on here, and I kept thinking about it, and I was trying to figure out just exactly what it was all about. Now I'm pretty clear on it now. Okay, thank you.
The two other primarily federally funded programs that we have are the Ombudsman Program, which is the long-term care ombudsman, where we actually have one employee and a network of volunteers that go and monitor and advocate for residents of long-term care facilities, nursing homes, rest homes, those kinds of things, and advocate and make sure that they're getting all the rights they deserve and all the benefits they deserve. So we are actually in those nursing homes and rest homes every single week on a regular basis with a trained staff of volunteers monitored by one paid employee, and we cover all the ones that are in our service area. I think we have 11 at the current time that are still operating. So that's a network of primarily volunteers that we use to monitor and advocate for long-term care residents. The other program that's primarily federally funded is the Money Management Program. That's a program, again, where we have one paid staff, about 50 volunteers, who actually work with elders to make sure that they are able to manage their basic finances. Maybe they're having some vision problems, maybe they're having some physical problems and arthritis or something, they can't write checks. Maybe it was a couple and the spouse passes away, but the spouse wasn't the one that always handled the money. We have both men and women that fall into that category, and they've not handled it, and all of a sudden, you know, they're living on half the income they were getting, and they have to figure that out. And a lot of times it comes down to helping them stay in their apartments or in their homes. Just if they can just manage, they've got the money, they just need help kind of managing a budget and doing those kinds of things. We currently have about 55 people that either we're doing what we call bill payer, where it's simply we're helping them manage it, they're still writing the checks, but kind of in with a team or assistants, or representative payees where we actually manage the account, write the checks, so give them an allowance, but still allowing them to stay in their home, their apartment, whatever their living situation is. So that's, you know, that's the goal of that program, is just to provide that little bit of assistance, whether it be through a rep payee or a bill payer, to help folks, you know, maintain their independence.
Right.
You know, like the list of people that you do have.
Mm-hmm.
Say with the bad storm that we had in
Mhm.
October,
Mm-hmm.
what did you do with people that we didn't have any power in this city for several days? So how was that handled?
Well, actually, what we did, and that'll segue over into our more state-funded programs, and the biggest one is what we call home care. And that's where we are the caseworkers, and we get vendors to support folks who are living in their homes over the age of 60, have some disability, some type, but need a little bit of assistance to stay in their homes. But you know, other than that, they're fine. So we keep a list of those folks, and we have them rated: most at risk, least at risk. And during the storm, what we did, we lost power as well. We were out for a couple days. But what we did is we worked, all the employees have those lists, and when we started calling, you know, most in need to least, you know, and kind of worked our way by priority through that list, and started calling those most in need, you know, people at home using their cell phones, whatever they could do, just checking on those folks that have been identified. You know, if the power goes out for 12 hours, we need to call these folks. I mean, you know, so given that we knew it was going to be several days, we worked that way and started working on our priority list that we have for all 24 towns that we serve. So we keep our folks that way. Every time they come in as an intake, if they're going to get home care, they're ranked. And so we know, and it changes over time, that's entered as well. So we always have a list of most in need to least in need, and then when a storm or something comes up, we can contact them in that way. And make sure their vendors are still coming, make sure they're getting what they need. Do they have family members? Do they have their electricity they need to get out? The other thing that happened during the storm, because we didn't actually miss a day of delivering meals during the storm. We delivered every single day because power came back to the Sala House where we have our kitchen, so it came back pretty early there, so we were able to keep the meals going. But because of the meals, someone delivered to that house every single day and was able to check and make sure, is this person okay? And we had a couple folks that we then in turn called EMS and said, we think this person's in distress. Maybe their house has been out there for several days without electricity, no heat. They're already under distress. So during that emergency, the Meals on Wheels drivers really played a key role because there were 170 meals in Northampton that were delivered those days that wouldn't have been delivered otherwise. And those people, somebody put eyeballs on them and said, well, they're okay, they're not okay. They called someone, whatever it might be. So that system is always great, kind of in the background of an emergency, because as long as we have electricity and the roads aren't too dangerous, we're usually out there delivering. So we were lucky; we didn't miss any during the storm. Our office was closed, but we were delivering meals during those few days. So that the home care program is really about taking a state allotment of money based on one person's eligibility and need, and using a caseworker to say, okay, we have this amount of money, and we're going to get you. Meals, 5 days a week. We're going to get you a little bit of homemaker. Maybe you need some help with your laundry or some homemaking. Maybe you need some personal care. And what we do as the case manager is we allocate those funds to make sure they're getting what they need to stay in their homes, stay healthy, stay independent. As part of that, we have a fleet. We have a crew of nurses. We have 6 nurses who go out and do the assessment. So it's a medical assessment by a nurse who's trained to say what are they eligible for, what aren't they eligible for. And those kinds of things. We have programs that are specifically for people that would be eligible to go into a nursing home based upon their condition, but they can get an enhanced package to stay at home and stay out of the nursing home. So we do those kinds of assessments and eligibilities and those. And we also work with the nursing homes to get people out, maybe who have maybe they've progressed, whatever it might be, and then they want to come out and try and find the services they need to bring them back into the community. One of the biggest programs we have is home care resources, what we call home care resources. It's essentially information referral. You can call Highland Valley 5 days a week, 9 to 5, 800 number, and say, I'm a loved one, I'm a spouse, I'm an elder, and I don't know what to do. Or they were in the hospital, now they're out, and I need this assistance. And we will walk you through all the programs that they would be eligible for, whether we provide them or not. Even if they're programs that we don't provide, we still have the database with the information for the Alzheimer's Association, for the Mass Association of the Blind, for the Senior Center, for all the different programs, so we can say, hey, maybe we can't help you, but maybe you should call here, or we work very closely with the Veterans Medical Center up in Leeds and things like that. So we're getting thousands of calls a month just for information. And that might be all we do for those folks at that time, but maybe later on things progress and they come back and talk to us. And then the last program I just want to mention is our Protective Services program. We are responsible in the 24 towns that we are designated in our service area to investigate suspicions or allegations of elder abuse. Physical abuse, mental abuse, sexual abuse, financial exploitation, neglect, caregiver neglect, self-neglect. All those fall into our bailiwick as the Protective Services designated agency. At any given time, we might have 80 to 100 cases active amongst our staff. We have 4.5 staff that are investigators. And those come in 24 hours a day. If they come in overnight, we get a phone call in the middle of the night. There's always someone on call. People call the hotline in Boston and they refer it to us. So that's really is a 7-day-a-week, 24-hour-a-day activity that I am sorry to report to you is one of our fastest growing areas of service. As more and more people age, as the economy gets as stressful as it is, you have multi-generations living together, perhaps not voluntarily. The Protective Services area is an area that's certainly growing.
You're seeing that.
Yeah.
Even on my ward, instead of just one family living in there,
Yeah.
multiple.
Yeah, and that's it creates stress and economic stress and family stress. So that's an area we certainly are seeing grow, unfortunately. And back to home care, I'll just mention as the budget process is going on, and Patty's feels the effects of this as well at the state level. Right now we have waiting lists for home care because the budget is not there from the legislature to allow the number of slots that we can do, and they allocate them out. And so actually, if someone calls and they're a fairly low need person, they're going to go on a waiting list to get basic home care. We're hopeful that when the conference committee is done at the state, that there will be some extra money from last year to this year in Protective Services. They're trying to bump that up just a little bit. Right now, as it is structured, and I'm not talking out of school because everybody knows this, even no one disagrees with this. Protective Services is underfunded. So, agencies are, using this program that runs a little bit of a surplus and pulling that over into protective services, because, we're mandated to do it. We can't just say, oh no, we've got enough cases, we can't take any more. We have to keep taking them regardless.
What's the census of people who are not being served now?
And on our wait list?
Yeah.
Right now it's pretty low. I think we have about 10 people on our wait list, and these would be what we would call 3 and 4s, the least in need. So, they're probably, they're not in great need. They, can basically care for themselves, but maybe with a little bit of family assistance, that type of thing. But right now it's about 10, but it's over 1,000 across the state. And it could change. We'd start getting a bunch of calls for that level of need. I mean, it kind of, you never know quite, but across the state, I think it's over 1,000.
And as you said, you're an investigative agency, but not an enforcement agency.
We are not. What we will do, we will investigate a protective services claim. We will determine, one, is it a valid claim? Is there something happening there that shouldn't be happening, that violates the codes? We will engage the district attorney's office if appropriate. If not, we will try and bring the services into place. We will work with the courts, with advocates, with vendors, whatever, to bring the elder and the elder themselves into place to make sure that whatever the risk was is alleviated. Whether it's neglect, self-neglect, caregiver neglect, whatever it might be, we will try and resolve that. If there's obviously if there's malice aforethought, or if there's something more proactive happening, that's when we would engage the district attorney's office to say, whether it be financial exploitation or domestic violence or anything like that, then we would bring outside bodies into place. But we are not an enforcement agency. We are an investigation and referral or resolution by
Counseling.
Maybe they need home care. Maybe they just it's gotten into a critical situation. But some home care hours and things like that might resolve it with one of the other programs that we have. We run into a lot of situations, not as much here in Northampton, of course, but especially in the hill towns. People lived alone for a long time, live in an isolated area. Everybody knows them, kind of like everybody minds their own business, and then all of a sudden they have a crisis, and often things can deteriorate very quickly. Maybe wandering if they're having dementia, or a spouse passes away and now they're on their own in a big house. So those kinds of things sometimes happen, very quickly.
And another common thing that's on the increase consequently because of the economy, that scams, things like the driveway scam, the roofing scam, the various phone scams that are perpetrated.
Yeah, we typically, on those, we will refer them either to the local police or the local DA. One of the regulations, or one of the guidelines for us, is there has to be a relationship between the alleged perpetrator and the alleged victim.
Okay.
So, again, we're not a criminal, so if just something's going on, we might tell the police, we might refer them to it, but if there's not a relationship between the two parties, then we typically will refer it to a police agency or something like that.
But it's also not beyond your scope to advise someone.
Oh, no, not at all, and we do that all the time. A lot of times we'll get calls into information referral, and someone will call and say, hey, I got this strange phone call, and and we're always picking up, if we hear about them, we're kind of keeping people informed, because we often do get those phone calls like, someone just called me, should I? And we'll say, well, no, you better check with someone else and make sure first. So yeah, we're often kind of a conduit for information back and forth.
So,
I was just going to say, the same thing happens at the council on aging.
Right.
And we also are a reporting agency, so we may call Henley Valley if there's a situation, let's say of domestic abuse or partner with elder abuse.
You guys are mandatory reporters.
Yeah.
You don't get to try to decide if something's actually occurring. If someone's indicating that it is, you are required by law to pass that information.
And then it'll come to us, and then we'll use our guidelines and experience to kind of evaluate, well, is something really occurring here? If it is, then we'll go out. And if not, then we'll close the case.
you talk about the relationship.
Yeah.
You mean
Yeah.
a relative or?
Well, not necessarily, but there has to be some connection between the two parties. If someone the elder is walking down the street and is mugged, there's no relationship between those two parties. But if an elder is living in the first floor apartment and another person is living in the second floor apartment and allegedly, helping out, but yet where's their Social Security check going? They're paying their bills, but they're also taking away the extra money. That's where we would say, okay, there is a relationship, and then we could come in and try and intervene and either bring in the police or take whatever steps necessary to protect that elder. It can't just be a random or a completely anonymous crime type thing.
Because it happens a lot.
Oh yeah, no question, it does. But that's really more for police. I mean, that's really a crime in the sense of a police investigation, as opposed to ours is about individuals who know each other are not, neglecting, abusing, exploiting elders that they either know or related to, whatever it might be.
Okay, thank you.
Yeah.
So essentially, John, as you've described, you're a clearinghouse for a variety of things, wellness checks,
Yes.
council services,
Mhm.
focus on services, distribution of services.
Mhm.
And we talked about this when you worked for us.
Right, at the CDBG, yes.
For us, not
Yeah.
giving you any money.
Glad you come in. I'm internal office.
But relative to that storm, I mean, I can't emphasize enough how important it is that Meals on Wheels actually serves as a contact point for wellness checks. And the storm's a perfect example because actually what happened was we not only lost power, we lost phone service and cell service,
Okay.
which is terrible for people who are stuck in cafes who can't go online. That's a different trauma altogether.
Yes.
But it was even more terrifying for neighbors because we have a reverse 911 system that only works if your phone works. It only works if you have a phone that's actually built into your wall or directly plugged into your wall. It doesn't work for cordless phones that run on power. So there are a lot of people who were in the neighborhoods who were concerned, who weren't getting calls because they weren't aware that their phone wasn't going to work. And didn't know how to call out in those circumstances. And this came up in EMS discussions, doing a postmortem. And it's a considerable comfort to know that you have people who are going to these houses for people who are actually on your radar and checking them based on a critical priority list.
Yeah, and across our system we do about 500 a day, but here in Northampton about 170 meals, of those types every day. And back to where you started, you're correct. We don't provide a lot of direct service, but we provide a lot of conduit and getting people to the services they need or arranging for the services they need and then monitoring to make sure they're done correctly, because we'll contract with vendors to do home care or whatever it might be. So yeah, we're kind of the cog in the middle sometimes, but is making sure that clients or individuals are getting the services that they need and then monitoring to make sure they're not being taken advantage of.
And during that storm, did you find that all the vendors are still operating?
I must say, the network of vendors that we have about 30 that we work with, were just exemplary during that storm. And we had folks going out the Sunday. I mean, we had vendors going out because there were people who are 7-day-a-week people that they're contracted to see.
Yeah.
So they've got to get out there.
Excellent.
So I mean, yeah, it's really, the folks that do that work, they're not doing it for the glory because it's really difficult work and they're way underpaid. Yeah, they really performed it in an exemplary way during that crisis, especially given that it kind of kept extending. And I think that was really a challenge. And just like us, and I'm sure just like the city, I mean, we had our own staff to take care. We had people that had, we had people without electricity for I think up to longest one was 9 days, I think. For, one of our staff. So you're trying to balance those two things.
Now, you said you have 6 nurses on staff. And how do you fund those?
They are funded through the state, through that program.
They're funded through the state.
But it's a state program, so we're kind of allocated based upon the size, the number that we do. So there's kind of an allocation that allows us to hire a certain number because we have so many recovering, we have so many cases, and there's kind of a formula you work out to make sure, well, how many do you need? An agency like ours, of which there's 26 others around the state, but the ones in Boston, they might have 12 or 14 nurses.
Yeah.
Because they're covering a much bigger geographic area, or they're just covering more people, or that type of thing.
So the formula, who works out the formula? The state?
The state does, yeah. That's through the Executive Office of Elder Affairs.
Okay.
That funding comes through there.
Okay, thank
Is
you.
there anything else that you want?
No, but I do appreciate the invitation.
Oh, thank you for being here.
My pleasure.
Patty, you again.
Thank you.
Thank you.
Thank you.
Thank you.
Patty, we can bring the mic in and we'll move one of the chairs back. So,
Let me take one.
yeah.
Yep.
We need to bring up.
So Dan, do you want to come up forward, Michael?
Yeah.
Tisha?
Hi, I'm Tisha.
Hi.
I want to bring.
Everybody likes that, how good.
Honey, hang on to my hand.
If you want, you can we'll get Michael and
Good stuff.
put your
Dan,
hand.
going?
Hey, Mary DeBarge.
We're a little late, huh?
Yeah.
How's it going? I don't know. Living the dream.
Let me move up a little closer. Hi guys,
Hello.
how's it going?
All right. Michael, can you get up?
Here, let's, pull this out. Michael's down here. Tori, Michael's gonna be right next to you on the right hand side.
Okay. Hey Mike.
Here. Here.
There.
Yeah,
Okay, I want to thank some of the members from the Committee on Disability for being here. And to my right is our Council President, Councilor at Large, Bill Dwight, and Councilor from Ward 7, Eugene Casey, and Mary Ann Labarge, City Councilor from Ward 6, and the Chair. So, Michael, you're going to give us an update on the Braille and large print menus in the restaurants? And I know Tori will want to talk about it.
and so do I.
All right.
So you all chime in.
Yeah, so I don't have that much to say, I guess. Yeah, I mean, the Committee on Disabilities right now, our current project for the next several months is to try and get restaurants in Northampton to have available to people a Braille menu and at least one large print menu. That we feel like that will be a good idea in terms of population getting older on the one hand, and in terms of Northampton retaining its image as a welcoming city on the other hand. So that's one of the things we're working on.
Also, I think you should also let, especially our council president, Bill Dwight, know that we've been working on this, what, Tori, for about a year now, Patty?
Hardly.
Since last year.
Feels like it. Yes.
Yes.
Yeah, it's been a long time.
Yeah,
And
'cause,
they're also working with the Yakuza from the bid. And we thought things looked really great there for a while. We had like 5 to 6 restaurants, but all of a sudden, Patty, you can talk about what went on there.
Dan Cuso has been very active with this Braille and large print menu project. And apparently he lost his staff person, and that kind of made everything take a back burner. And so Dan came to the last meeting, and it's been resurrected, so he's back on board. He has a person who is also a graphic artist on staff, and so now it's moving forward again. And what Dan had said at the last meeting was that the focus is gonna start on the Braille menu and then the large print.
I thought it was the other way around.
yeah.
That they were starting with the large print because that was easier.
Like at some of the restaurants, like
That's what I thought too.
The large print.
Yeah.
Yeah, I thought they were starting with that, and he had actually didn't he show us a sample of what the print was gonna look like?
Yeah.
He had a sample of the large.
Yeah, and then they were gonna work on the Braille, would be a little more complicated, so that was gonna come next.
Like later. That's yeah, 'cause they were he said
Can you say what your name is, please?
Letitia. Thank you. Yay. Whew, nervous, but anyway, this is fun. Anyways, he was this time they're gonna do like some of the restaurants like that's early, but the last time you were so funny with the last time I went to a restaurant, I got menu and it wasn't large print, but so I went there like last week. Anyway, so this time he's gonna do some large print for like some of the restaurants like what was it? Was it the pizza place that they were doing? Sam's, yeah, but they were doing Fitzroy's and some other ones.
Eastside Grill, I think, was interested a lot. It was, right, this project is focusing right now on restaurants in downtown Northampton.
Yeah.
You were saying 5 restaurants, right?
My understanding, right, and I believe we want
Right, that's what I was gonna say, I mean, we're talking 10 menus,
Yeah.
right? Five in large print, 5 in braille, and
Yeah.
transcription machines for braille are pretty, it's not like it's really newfangled technology
No.
anymore.
Right, well, those were like $35 each.
35, well, for something like visual is like 25 pages or something like that.
Yeah,
And then
but
you're-
yeah,
it's just a-
Pages now.
Yeah.
My name is Tori Eklund, and, the research that I had done indicated that it was about, I think, $30 or $35 per menu, but it would vary depending on the size of the menu.
Right,
And
Yeah.
it's the, the Perkins Library for the Blind that
that's what Danny said.
they, do the work.
How many, people that are blind
Like
can read braille?
That is a really interesting question. There
Yeah.
should be more, in my opinion.
I mean,
I think as we see more people who are losing their vision later in life, for those people, it's harder to learn braille, and so a lot of people don't, but for people like myself, who are born blind, or people who lose their vision very early, they do. So it's definitely a smaller percentage, but there are enough that it will be a good idea. I mean, I just from knowing people in the community, I can count quite a few.
Yeah, this is all, like when I was younger, before I lost I used to have cataracts, and then before I used to do braille, but it was too hard for me, so now I just do print, but I think a lot of print menus, for me and for other people, that have trouble reading, with their glasses, if it's really small, it'd be good for them for large print. Big letters, for large print, for maybe say Patty, for her vision, she could do it, or my friends.
Did the Committee on Disabilities investigate the possibility of any grant money that might be available for?
No, we really haven't yet, although that probably is a good idea.
That might be a good idea, yeah.
I think that
It was,
The bid was
I
under
think who's gonna,
The bill is gonna cover it, but so it's not so much a question of money, it sounds like a question of manpower, was what,
yeah,
I think
question is
logistics.
just doing it.
logistics.
yeah, I think it's a question of logistics.
Yeah, I mean, the restaurants that I've talked to have seemed pretty reasonable about wanting to do it.
That's true.
Like the Dirty Truth says they'll set it up, although they don't do it, they can't cover all their beers.
Right.
The menu they're willing to do.
Well, this takes me back a little bit back when I used to be on the Committee for Disabilities.
Oh, really?
We got commitments from a number of people, including the city. In fact, actually, Michael's going to mention this, I think, about accessibility, about for doors, automatic door openers,
yeah.
ramps, and access.
Yeah.
And as Michael pointed out, he couldn't even get into the city council chambers because we do not have a door opener. We had a grants program. We were giving people money
Yeah.
to put in door openers in their place. And the problem was lots of good intentions expressed, very few door openers installed.
Poor Michael's still asking,
Well, it's,
because he
it
comes to
is,
city council.
no, it's actually literally criminal that he can't access his building.
Exactly.
It's in violation of ADA standards, and
That's
it is criminal. And well, enough said, I'm not
Okay.
preaching to the choir, but.
Well, I won't file suit just.
Well, thank you, but
No,
actually,
don't even think of doing that.
well, actually,
no.
I think the expression of that as a possibility might provide some incentive to, so, I wouldn't discourage you in that respect.
For me, I would say maybe they should fix, the doors, for people who have, wheelchairs that can't get in, because it might be hard for them to open, because it's, so heavy, and they should put, a little button.
Well, you
Yeah,
really
that's
just-
what we're looking
yeah.
for.
Patty, because it's been brought up so many times at our committee about our council chambers and not being able to have who have you talked to in regards to the door?
Well, Central Services, but that was,
Because I know we did
before-
City Hall.
before David Pomerantz.
Yeah.
It was my understanding that there was money available that was gonna happen, and obviously it hasn't.
I think we were first talking about it when Mary Ford was mayor,
Yes, you're right.
Mary Claire.
and then Mary Claire, and then Sue Ryan. So that, three mayors, and it's not so much on the mayors, but it was
Well,
Jacobus, it was being
It was,
discussed.
yeah, it was right,
Right.
yeah.
Right.
Do you think there's a possibility you could give Pomerantz a call?
Well, I think would be more helpful is a memo from the Committee on Disabilities, because David
Yes.
is not gonna prize this necessarily. A Committee on the Disabilities to, talking about that specifically, particularly as it relates to city,
Right.
access to city buildings. Particularly this is the one space that we provide as a community. This is what the council needs it. It's having access to your government is kind of important.
That's true.
Right.
Or could
And
you
then,
write it?
well, no, I'm not on the disabilities.
Oh,
Committee.
yeah, well, I thought you meant our committee.
No, I think the disabilities committee should be coming from the disabilities.
Yeah.
Committee.
Well, that can be brought on the agenda tomorrow, we have a meeting
Yeah.
tomorrow.
Oh, there you go. And as for, again, the issue of the menus, it sounds like you have lots of restaurants lined up, willing to do it, you have a bid that's interested in doing it, there are some impediments for manpower and stuff like that, I don't know what you could do to offer to help. I mean, large print, literally, that's a question of, you can do an OCR scan of it, send it to Paradise Copy, and they can print up a large print,
Yeah.
a large print
Jesus.
menu.
Right.
I could do it with my iPad.
Oh, really?
Yeah, and
Yeah.
it's on a field of white with large black letters.
Or your iPhone.
You're on.
Yeah, my iPhone too, yeah.
Why don't we just do it,
That's true.
why don't we just do it in the house?
Well, that's
Just
me,
doing that.
I don't, actually, Danny, I don't see why we couldn't do that, I mean, the Braille's different,
Yeah.
clearly large print, I
Right.
could see that it is something that, actually, we could do, it's literally scanning the, menus. Now, some menus are all goofy with pictures and graphics and stylized lettering and stuff, it might
Maybe
take a
the
little.
guy who owns change it.
And the braille menus,
Yeah.
it would just involve someone sending them photos.
Yeah, that might take a long time though. Right?
It's a meeting.
I'm sure the turnaround time for it was fairly quick,
Yeah.
couple of weeks.
But yeah, there just needs to be someone who has the time and energy to like put the menus in envelopes and send them there. Because
Yeah.
then the turnaround time is a couple of weeks and then we would have them.
I know, I mean, that is not a lot of money.
No.
Well,
Right.
then, I don't wanna put a lot on your plate for the Committee of Disabilities, but maybe if you guys go over and gather the menus and say, can we have a copy of your menu to send off to Perkins to get converted for Braille?
Yeah, maybe we should just do
And then
it.
so that we can
Yeah,
convert
that
them,
makes it.
Yeah.
we can convert them to large print for you as well, and we'll provide them for you.
Right.
Do you,
Yeah, exactly.
do you think Channel 4 could help maybe present it, like maybe we could do some, like,
Right.
so everybody in the whole town probably doesn't know.
Well,
about
that would,
Right, I think that's a reasonable thing
After
to
it's done.
do, but we'll take care of that after it's done.
right,
And I think it'd be really nice to see if we could get some coverage from Channel 40 or Channel 22, or even other places in the state that do disability issues.
Is that still a Northampton Restaurant Association?
I don't know. I think it's all, it may be just all part of the Chamber of Commerce at this point. But the Chamber's not a bad group to go to as well.
Well, they have been
Maybe
working,
under the big,
the Chamber of Commerce has been
Yes.
working with Dan Yakuza, and then whatever happened with the Chamber head?
Suzanne, I guess is more involved with Dan on it than us specifically.
That's true. And I have another restaurant we could suggest, maybe we could talk to Dan, that pizza place,
Dan was at our last meeting, and we already know, you were there, what his plans were.
Right, it was just, I think what it's come down to, just so that it can really finally get off the ground, was 3 to 5 restaurants, and if you're all saying it was the large print, versus Braille to start with, and then with the publicity that we had all talked about as well, that would perk up other restaurants to wanna get involved with it.
Right.
I would think that you got 3 to 5.
But we could have our council president,
hope
Bill
so.
Dwight, be the chef of the night
That'd be
You would-
cool.
and do the cooking,
I don't think.
and
you'd
then
want
we'll
that.
have him say, you know, do a huge fundraiser.
Peanut butter and jelly sandwich.
Yeah, good one.
I
That
want to
that
think
is
of
so cool.
I'll
And then
think of a different
maybe we
fundraiser.
put the mayor and my wonderful guy David Mercer, because he probably doesn't know, because he's not part of this, that's why he probably doesn't know about this kind of stuff.
Well, his ward is up in Florence, and there's Florence restaurants as well. That,
We'll get to it, yeah.
but I think you're right. I think Danny's right. I think that you guys are right. That pick your top 5, get them, give them bragging rights, get publicity surrounding that. Other restaurants would be an easy sell. I think
Yeah.
Evan Dunnett, who owns the Green Bean and also the Roost, would probably be favorable to this as well.
Yeah.
How about, Paradiso, that pizza, Paradiso.
Oh, Pizza Paradiso, Claudio Guerra owns. If you get Claudio Guerra to sign on, that's 4 restaurants in town.
And it's really, yeah.
Yeah, I think.
I could talk to the owner, if I went there, I should say something, but I could.
I think
Tori, if you can recall, remember I mentioned we should actually go into the restaurants and meet the managers, because that's what needs to be done, is the visibility.
I think we should talk about, maybe tomorrow in our meeting, we should talk about putting in the schedule to do that. I actually have some vacation days coming up at the end of this month and could possibly do that with someone.
I'll do it with you, Tori, I go downtown a lot.
If there's transportation, which
Thank you.
brings me to another. Are we gonna talk about transportation?
Well, we
Here,
certainly will,
Oh,
and we can talk about transportation now.
Can I just say a word about transportation now? Is that okay with everyone?
Across the street.
Yeah,
Um,
I think we're up to.
okay, is that okay with you? I didn't
Thank you.
usually take
Yeah,
that one.
that's fine.
Okay.
Starbucks.
I don't want the band to hit there really bad.
I'm really concerned about the proposed fare increases for PBT. I think I'm the person that Mary Ann was referring to a few minutes ago, who I work full-time at a nonprofit agency in Northampton. I don't make a lot of money, although I love my job, and so transportation to work is now $2.50 for me where I live, up in Ryan Hill. It's proposed that I would be one of the people that could possibly have to pay $7. I won't be able to use the van.
That's one way, right?
That's one way. I won't be able to do it. Like, I will have to scrounge and pray that people can give me rides. I don't know if there's anything that any of you can do to influence that, or if there are any grants or anything that people can apply for to subsidize or help with transportation. But this is like a huge source of anxiety for me and a lot of other people from the disability community.
That's why I don't want to use the van, cause I could just like go out with.
Is Leslie Steiner still on
Yeah.
Yeah,
the disabilities committee? I mean,
no,
No.
she's not on the disability.
No, she's
she's
not.
still on the PVHA,
Yeah.
Yeah,
but she's also former member of the disabilities committee.
Is she?
yes, it's been a long, long
A long time ago.
Yeah.
She used to be on the disabilities committee, and she actually would, because she's vision impaired, and that's in fact, one of the reasons she's on the PVTA board. But she would be a very good person to, be, and in fact, actually, I think, as everyone's vying for, transportation routes, PVTA is reducing routes, reducing fares,
Oh,
for all the reasons that you would imagine, but the fact is that the way these things work, no pun intended, it's squeaky wheel politics, so the more noise you make, the more inclination.
They are making noise in half the room.
If it's okay with people, I'll call her, because I know her.
Okay.
Is that all right?
Sure, go right
I'll
ahead.
call
that'd be
her.
really good.
Leslie Stein.
Yes, I know her. I'd be more than happy to call her. I feel like she probably is really aware of it, but it would be great to just connect with her about it.
It helps her to
She's
have,
asking if there's any kind
I'll do it
of
this week for sure.
help out there for her.
Yeah,
Because of, if just in case they
if they
do
do
go on
it,
that
like,
cost,
what am I
she can't
supposed to
afford it.
do?
well,
I know.
it would also help Leslie if she had you call Tori, because it's reinforcing the case that she has to make.
Okay,
If she's not hearing from people, she could make a more emphatic case when she said, I have a number of people, the Disabilities Committee in Northampton has expressed serious concerns about the proposed changes. And that, so absolutely, don't be shy about calling.
I'll do that this week. I'm pretty sure I have her phone number at home, if not, I'll find it.
Because you
Okay,
figure
I
at
was gonna
5 days
ask
a
if you
week,
had it.
at $14 a day,
That's
you're
too
looking
much.
at, what, $70?
Well, I
Let's
personally,
paycheck.
my life circumstances are such that I only need to take it one way. But there are occasions where I need it both ways, and even one way, it's too much. That's $35 a week, that's $140 a month. That is like off the chain.
That's why I didn't wanna take it, cause I heard the price go on, I was like, no, thank you.
I mean, I won't be able to do that, nor would I want to, actually. Even if I could, I wouldn't want to patronize a service that actually did.
No.
Right.
And just think, Tori, at $70, right, a week, times 4, which would be $280 a month.
Holy,
That's like,
That's
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 like
disgusting.
my monthly grocery bill. I mean, that's crazy.
I know, that's,
That's
You're
like
talking
my-
about $3,500 a year.
Yeah,
yeah,
it's horrible.
And Leslie Stein would be a good call, because she could be quite assertive.
Okay,
And
I forgot about her.
I wasn't gonna use the word aggressive, but she can be very assertive.
Yeah,
Um,
I will try. I don't want to promise and then not talk to her. I will try to call her this evening, but if not, I will definitely call her this evening.
and Tony, I can help you with that, because I know I don't think I know her, but I would like to help, 'cause I don't want to trust myself taking the pubic hair back right now, cause it's a little but I like the way that was, but
Well,
Why
I'm
don't we,
gonna call her tonight from my house.
that sounds
Or
like a
you
plan.
could just.
Why don't we go into the handicap parking fines?
Yeah, I just want to report that, I talked with Lisa Lampern, from the tax collector, and getting an update monthly, and right now in the parking fines, there's $4,000 for the Committee on Disabilities.
Excellent.
We have nothing,
Outstanding.
absolutely nothing.
you don't? You guys should do a fundraising.
We didn't have any.
She talked about
We did.
the old days.
No, last year, we
Last
had
year?
nothing.
Well, that's old days.
At one time, in the old days, we had $400,
Mm-hmm.
which got wiped out, I don't know, about 3-4 years ago.
Are there-
An ordinance in
Are
place.
there stipulations of how that money should be used
Yes,
Yes.
by ordinance.
by ordinance? Okay.
Mhm.
And so again, let's just thank Councilor Labarge and Casey for bringing that forward to the city council.
And I didn't bring that ordinance
Yes, thank
either, I
you.
don't have it with me, so.
So that's good news, and that's since July 1st, 2011. So that's great for the Committee on Disabilities, it's great for people who are
Oh, yeah.
actually disabled and need a parking space that, you know, is a handicapped spot because somebody illegally was parking there.
Right, maybe Councilor Casey can talk about the ordinance that we put in place and.
Yeah, I should have brought a copy, I had a copy of it out too. But you can access that for $4,000 if you have a need.
I know,
Just
but
a written request.
Can you explain how we went after that money?
Going through the budget year before last, and comparing it to the budget the prior year, there was $400 in a line item for, the Committee on Disabilities. And then I saw in the next budget, it wasn't there, so I had asked the mayor, what happened, and she said that she had to eliminate, she was cutting line items. So anyway, I dug into the, taxation, municipal taxation and finance law book, and it was right in there in black and white that any handicapped fines could go towards a committee or a commission on disabilities. So we formed a commission on disabilities, we put that in there. That was what, that was, there was a difference between committee and had to be a commission, so we did that by ordinance.
Right.
And, so now, whatever money is in that pot, you can request that for a particular issue or item, that you need. And, I don't think,
Like Patty can talk about.
I don't think it carries
It goes year to year,
Year to
year is
year.
over.
year to year.
Right,
So you could have $8,000, if you get 4,000, you get 4,000 again, you could have 8,000.
the cap is 7,000.
The cap is 7,000.
Remember, we just approved that.
Yes.
So
And-
last year it was 5,000.
Yeah.
And of
Holy
course,
cow.
that is money that we could spend or expend in setting up things like the menus.
Absolutely.
And the bus, like
The library,
Or if you do want to do a mailing,
printing.
Right,
this is
now
what
we're,
we're mailing,
yeah,
use for postage.
redoing our, access in Northampton booklet is what we wanna do, and,
Yeah, that's the kind of the second thing that we really want to take care of
right.
over the next few months, is to update the book, in terms of the constant change of locations and shops in Northampton.
Yeah.
Constant increase in disability parking in Northampton, or what has been an increase since the last time.
And everything
So,
else.
and, yeah, and just to provide an update on everything that is going on.
In our world, yeah. In our town, in our city.
My suggestion was that would be a revolving account that would go right into, and you could spend it, out of the commission by writing a check,
Right.
or sending a slip to the auditor's office. That was my, I guess, I got shot down on that one, but, that's what I had expected. I expected it would be a revolving account that you would just draw on as you need it.
Right, but that's not gonna work, so,
So now you have to put in a formal request, goes to the council. Yeah.
okay, can we, put in a formal request to the council that includes, a number of things, so that if we're gonna get, 4 restaurants
Or five.
that are, 5 or hopefully like 7, can we do a one,
That-
request
Lump them together.
for lumping them together?
No.
So we don't have to do each one individually?
No,
Yeah.
lump them together, but on the request, what you can use it for. And then it goes to the council and get for approval.
I hope it works.
Does it have to go to the council for approval?
no, I don't think so.
No, it does
Yeah,
not.
if
I
you
think
send
We
it
don't
out,
have to
no.
grant it,
No, it
No.
just is that,
not the
it's
ordinance,
submitted to the auditor for.
Yes,
for
that's
payment.
right.
Oh, right,
because
right.
you're the only one that has the permission, the authority. Whatever needs to be taken out, you're the one that has
That's
to.
right.
Okay, so we only have to write a letter to the auditor saying that this money.
No, Patty handles it.
Oh, an email. It could be an email, couldn't it?
Let's
Oh,
just say
alright.
we were gonna have the booklet printed. So
Oh,
I
okay.
would find out how much it costs, and then if we were gonna order it, and then submit it to the auditor for payment.
Exactly.
Yeah.
And
But
then,
Okay.
Yeah, so it's not a request, it's an invoice.
Exactly.
It's an invoice,
yeah,
like, on the email or.
We tried to streamline it as much as we could to get it where it was easily accessible.
so it's pretty much the same way we all do invoices with our departments.
I'm not doing this for.
Okay, let's get into the Board of Public Works means-based permits for seniors and disabled.
Oh, yeah.
Patty?
So I guess I'll address that. Probably at the beginning of this year, we had gone, and when I say we, some committee on disability members, some community members, and Councilor Labarge and myself went to a DPW meeting, and it was about the ordinance that was in place at one time that allowed disabled people to get a vehicle permit for $1, and that it was no longer in the ordinance anymore. Somehow it got removed, and how is this all gonna be adjusted and taken care of? But in the meantime, what we found out, and what DPW had done at that meeting was to organize a subcommittee, which Mary Ann, myself, Ruth McGrath,
Diane Lake.
Diane Lake, were put on it so that we could discuss what it is to allow and, assist a disabled person or an elderly person, 62 or older, to be able to get a permit to the landfill. We all know the landfill's closing, so that added another layer of uncertainty. What the DPW was working on was a means-based permit, which means that based on your income is whether or not you would get a permit. Right now, it was $5 for seniors, and to make a long story short, but I'll just say that there were a lot of times that we met at Committee on Disabilities. We talked with Karen Boquillan, who was really the go-between between this, quote, subcommittee on dealing with this issue versus the subcommittee that DPW had. We never, ever crossed paths. It was all through Karen, which I think was a little cumbersome and not satisfactory. And the outcome, as I found out today, that DPW did vote, after postponing the vote a couple times, that it will be needs-based for a permit and the exclusion of seniors getting a discount. So I think Marianne and I were very, Councilor Large and I were very expressive about keeping seniors having the ability to have a discount. And so it is not going to happen. It is means-based, which I think opens it up to more people to be able to get a sticker at a reduced rate, but it excluded seniors who, by virtue of their age, should have still been allowed to have a discounted
I agree with that.
permit. But that isn't what's going to happen, so it's $25 for seniors as well as residents. And if you really look at a population, seniors are not the ones generating a lot of trash. They're great recyclers. So now $5 to $25, and that was voted at the DPW.
Right, and the biggest problem we had, councilors, was that we were asked directly to be involved on a committee. We waited and waited, never got any answers. I would ask Patty, have you heard anything yet? When are we forming so we can sit down and go over the means space? And Councilor Dwight, nothing. Absolutely no communication at all. Finally, Patty gets a call, something from Karen, and we invited her to our meeting. Is that how it went?
Yeah, Karen ended up coming to two Committee on Disabilities meetings. But as I said, there was never a crossover between,
Right.
it was sort of us and them. And, you know, I really think the whole situation could have worked out much better, and I think there could have been a parallel solution to this.
So right now, it stands actually on one level because it's means-based, you broadened it out, not just,
Yes.
there's not an age criteria, but there's basically means-based, which actually I personally prefer.
I think that it opens it up. I think that is good.
And you wanted to maintain still though the privilege for senior citizens.
Right. For seniors.
And so, but on one, so there's a good and a bad. The good is the fact that as far as the disabilities community is concerned, that there are people who weren't otherwise, that this discount is not available to people otherwise. And there was
Of
those
any
kind
age.
Of any age.
Right.
And, you know, so it's based on a sliding scale, does it require an application?
Yeah.
Yeah, it's gonna be, they have to provide documentation that they are.
You know, exempt from CPA,
Income eligible.
food,
Yeah, food commodities.
vouchers, all this type of
Yeah.
stuff.
You know,
And
fuel
So it's
assistance.
like qualifying for the lunch program.
right, and it's just like Patty had heard from seniors, they thought it was not in the right direction. They have always paid their $5 to go into the landfill or locust street, and they felt like it was a slap in their hands. And I have to agree with that. They worked hard all their lives. To me, why wasn't a compromise made, let's say, let's go $10?
I attended those, the BPW meetings, and also on the conference committee. And the board pretty much hung its hat on, they weren't going to provide a reduced sticker for Warren Buffett because he was old, because he was a senior citizen, or if it was Warren Buffett in a wheelchair.
Right.
And that was pretty much what they had hung their hat on, the whole meeting.
Yeah.
So, but like Mike said, it does open up to many, many more people other than just seniors or disabled.
Right.
And the other argument was that if they didn't want to pay the $25, they can dump their stuff at Dussos for free.
And
They don't
that's
need a
what's
permit.
gonna happen. And
No, I don't.
didn't I mention that, Patty?
Yes, you did.
I said, wouldn't you rather have
Excuse me.
a $5 or even think about compromising, okay? Instead of losing that, because that's where they're gonna go. No stickers, no fees.
And that's gonna be really hard for,
And we've had
Well, yeah,
people
people.
who even mention at our meetings that $25, it's food off their tables, if not, their medication they cannot buy.
that's true.
Well, I think, again, your assessment there is based on need. I mean, if somebody actually is relatively affluent and qualifies by age, I can see how some people might take issue with the fact of saying, look, they can afford this more than I can, yet I don't get a discount and they do. And you do hear that debate as well. So that, I mean, on one level, I mean, I have to say that I agree with means-based financing, because I think it means people who are not, or less able, for a variety of reasons, not the least of which is age, but any other things, including poverty, which
Right.
Well, this is what the means base is,
right.
it's basically strictly for poor people.
also people who cannot afford to pay this.
Okay.
That's it.
And I'm all in favor of opening this up
Right.
bigger for, this new
I'm
phase,
saying
but it was also, why can't we still provide something to
Right.
seniors?
Exactly.
I understand,
And Warren Buffett
As a
is not
courtesy.
living this
no,
down.
no, he does, well, but there are people, there's certainly people who can, I mean,
You're right.
I mean, there's certainly people who can afford it.
Right.
And the thing is that, as you also point out, this is actually all gonna change again anyway. But the fact is that the principal concern is at least accommodating those people least able to subsidize this. And to that extent, you're reducing income by doing that. And my guess, and I'm only projecting here because I was not part of the debates, they're saying we're losing it here, we'll make it up here. We'll make it up with people who had a traditional discount but who could afford it. Now they will be paying the same rate as the folks who don't have the privilege of being seniors yet. And so to some extent, but the fact is that they're going to be competitive with a private system that is right now not charging at all. And all those, and then plus as this makes its transition as to how the city accommodates and starts to deal with its waste management, I suspect we're gonna see it change several times over.
Right, well, we're hearing from many people saying that the seniors here who've been paying $5, they made this city what it's all about, and I will continuously say that. I think that it's a slap in their hand. Why? Why couldn't a compromise be made of $10? I don't think there would be a big problem about 10, but you go up $25
That's expensive.
just because they don't make the means base.
Well,
But it's not unique, but
That
that
doesn't
problem,
make any sense.
right now, we're actually debating something that's not even within our purview. We don't, even if
No, I know.
if the decision's been rendered, so now we're just doing a post-mortem.
Well, that's what we're doing, but
Right,
this,
but I
you're gonna
think-
hear more people coming in at city council about it.
But
know.
to me, it's like, where is the courtesy for a
Right.
senior citizen, whether
I
they
know.
could afford it or couldn't? And, you know, somebody could afford it, they probably aren't gonna ask for it for $5. There are people like that. And in terms of the number of seniors who are, you know, low income, there are a number of those people in the city, more so than the ones who are affluent seniors. But it's like, and this was the example I used, what if every store who gives a senior citizen discount says, well, we're doing needs-based. So if you make more money, we're not gonna give you 10% off on your groceries. So, I mean, to me, a city, what is
Right.
wrong with giving a senior citizen an advantage, something like, thank you very much for having been a citizen in our community, supporting us, and making the overrides happen for whatever it is that they did in the
Well, that's,
community.
but you know what, if I may just take this a little further, I'm 65, I moved here this year to
Really?
retire. No, this is just a hypothetical. If but I moved here, I'm 65, I have some relatives afterwards, I bought a house up in Ward 2.
Right.
I moved here, I haven't paid into it.
Right, you're
I haven't paid, I haven't done any, I haven't earned those privileges that you're talking about. But I think I understand, I mean, what you're describing is essentially an indignity as opposed to a burden. And I think that's kind of important. I understand why you know, all this time that you understood that by virtue of the fact that you're a senior citizen, you get discounts on any number of things, and suddenly as the discount starts. And you're going to see this more and more as the economy becomes tighter. You're going to see senior discounts at restaurants or senior discounts at stores and stuff like that start to diminish. And they're not going to be means-based, of course, because they don't care about that. But city and social services, I think it's true you're going to start to see a trend that way.
I also think it was the process. Four of us being directly asked by Karen to be on the committee. Okay, so we could work it out. Patty would have like a meeting held at the senior center. We waited, what, a couple of months, 3 months? Nothing.
Yeah, no,
Absolutely nothing.
that I understand.
All of a sudden, it was shut down our throat.
Well, we've all experienced that at some level.
Oh, yeah.
So let me just tell you, in Newton, they provide for senior citizens free parking downtown, okay?
Well,
There
Newton,
we go.
if
So
we
some
had
communities-
Newton's money, I would be so happy. That would be.
That'd be cool.
Newton also subsidizes its schools. They're one of the highest school districts, highest paying school districts in the
Right.
state. Newton, Wellesley, it's all, and Newton, in fact, actually, they used a comparison, and the mayor was making the presentation on the budget. Newton, for some reason, seems to be doing quite well. It's a very affluent community.
They were spending $39,000 per student in public school.
Yeah.
What?
So it's
I know for a fact, I did not support it. I still will not support this. If it was $10, that would be fine. But to say yes at $25, no is senior, is not right.
But the argument lends itself to many different things that we do in the city, such as parking.
Right.
You know, I work for a lot of very wealthy landlords that are 80 years old.
Yeah.
And whether or not I wanted to see them have a $5 bump sticker, actually I didn't. But we do it with parking. We're trying to arrange this awful equation of parking, and we're wondering whether or not a particular attorney or a doctor may get away with a cheaper parking pass when who works at Sam's Pizzeria for a couple of bucks an hour and gets some tips is going to have to walk.
Way too far.
So, you know, there's never going to be that perfect solution. It's just not going to lend itself to us. I know that. But we do. We care. There's some awful good arguments made for it on both sides.
Right.
And I would love to see somebody that was disabled and had no money get a break, a real break.
That'd be so
And
cool.
it didn't have to be 60 years old.
No, it could
40,
be
25.
or 26 or any, but I had an idea, maybe we could do like for this landlord, maybe we could do like a debate or like a bureaucracy, like, you know, like bring like everybody together, you know, when I have those like big signs that like you know what I'm talking about, like kind of when you do like, when you get like everybody together with a big signs, they have like a debate, like.
Or go face-to-face debate.
Or like get like a lot of people and like do like a thing like that downtown and.
Oh, you mean a protest?
Well, that may happen.
Yeah.
We just had that, come see that.
It could be coming.
Tea Party was protesting property taxes, yeah. So.
I didn't see
They'll
their
be
protest.
out there doing this one now, they're doing the taxes, and what else would they say on those signs?
I mean, would this be something that could be like grandfathered? So
Um,
that if you are
Right.
currently,
See, it doesn't come to city council.
Well, let me just say
They
that,
already approved it.
yes, it could be, but the fact is, one, this board doesn't have any authority over
Right,
it. Two,
it's
No.
strictly
that
Board
the
of
decision's
Public
been rendered by the Board of Public Works.
oh, okay,
So,
so.
I mean, that's what I'm saying, we're doing post-game review here, and it's.
Which is okay, because nobody knew it was gonna be voted on.
Right.
So, So as established now on a BPW policy, does not preclude the fact that it can be contested.
Right.
If you want to contest it and you feel there are adequate grounds and enough force of will to project on them, then you can do that. The fact remains that the decision has been rendered, it's now policy of the Board of Public Works, and we have absolutely no say over what the Board of Public Works does.
It was the process and the way it was handled.
Okay.
I,
Well, that
Which
sounds
we
like a
felt
protest,
If
although maybe
there
not.
was an adequate process,
Of
which
course, that's
four of us
cool.
were waiting. And it never happened until getting a phone call and getting our email saying that Karen was coming to one of our meetings. Bingo, that was it, and then Patty was the one that did the talking in regards of being misled. We all
Oh,
felt
yeah,
misled.
I've heard of
The
that.
three other people who were supposed to be on that committee, so. The Board of Public Works made their decision, that's it, and he's correct, because people can protest something.
That's the.
And I think once the elderly hear this, they're not gonna be happy about this.
So I'm gonna just say to end this, at least for me, at this meeting, is that, you know, means-based does open it up for many other people of different ages. But advocating for seniors, I find it disrespectful, no matter what your income is, that you're a senior, and just by virtue of your age, good for you, we're gonna give you a discount. That's like every senior discount that exists out there. And I can't think that this, I shouldn't say that. Okay. I'm gonna make a comment about the city, but I will not.
I would very much like to see, if you were 85 years old and you paid property tax in a city for 45 or 50 or 60 years, that you wouldn't pay any more property tax once you hit the age of 85.
Yeah.
I had always thought that was,
Well, actually, there are senior circuit breakers.
yes,
That-
there are.
that-
I
they'll-
see
I
something.
mean, let's be clear, there's senior circuit breakers for people of an age group.
70.
But, and in
Yeah.
fact, if we did that culturally for any other group,
Right.
we give a circuit breaker for if you are of a particular, well, if you're a particular religion, a particular race, people would say you can't do that. It would be outrage.
Right.
And so, in the interest of being fair and equitable, I mean, we provide those circuit breakers principally for people who are on fixed incomes, who are not able to sustain themselves. They may have paid their mortgage, but now the tax rate will be equivalent to the mortgage they were paying back in 1965. So that all makes perfect sense. That's actually means-based. It's a means-based system, but it's available only to senior citizens. It's not available to someone who makes less
I
money.
thought if somebody was blind also.
And blind, that's true, that's right, and veterans.
And then there is a circuit breaker that's set up by the state that, seniors can, do a formula, and, you know, ARB tax people are in helping seniors to do it, that based on what you pay either for rent or for property tax, water and sewer, you also can get money back from the state.
Right, so there's,
Yeah, it's a
it's,
credit.
we have actually determined as a culture that when you do achieve a certain age, you are rewarded for the fact that you've lived that long.
Right.
And either paid into the system or not. Actually, that's not the criteria. That you benefit with discounts or protection, some protections. Usually not adequate to the task in some cases for some folks. The fact is that's not available to a lot of other people with other circumstances. It could be as equal or more challenging. So, and in fact, actually, that falls more in the purview of the disabilities commitment somewhat.
Yeah.
People with disabilities do not enjoy some of those same protections that,
Right.
and so while on one end, my mother being a gerontologist, I mean, I have it's a cultural thing that we established over time that respect for seniors, respect for older people has to manifest itself in some way. And in fact, sometimes we think we're getting an easy buy if we give them a discount for a steak at Sizzler. More in fact, it'd be a lot better if they were accorded some respect in some other more meaningful way that had some quality of life issues. So, but you know, again, that's my personal philosophy. It has nothing to do with the flavor of this meeting and ultimately what we decide.
Because I do know, Patty, in Texas, no matter how much money you make, and I know with my son and her family, his wife's family, okay, money. They don't care how much money you make. If you are 65 and over, you are exempt from educational taxes. No matter if you are rich, you're still exempt.
It's also that Texas has one of the worst school systems in the United States. They do.
It is
They're one of the most
Yeah.
public
It's
schools.
one of the worst
I
public
agree
schools
with that,
system.
yeah.
And they'll execute you for hiccuping in that
And
state.
that's a,
I had a suggestion, you know, like the people,
certain parts of Texas, though, there are some good schools.
I'm
that's
sure.
true, like San Antonio,
Well,
so.
One other thing
And
actually,
Georgia also exempts.
that I have been thinking about and to see how this goes, if it does. Ramps for places with one step up.
Oh,
like
yeah.
most of the places downtown.
Oh,
Right. That if ramps
the
were
ones.
distributed to those places, which could be laid out when somebody using a wheelchair
like a portable.
gets there, that would enable me at least to get into a lot of places I can't get into.
Those
Because
things
the
exist?
grants.
What?
Those things exist, easy portable ramps that can,
Yeah, well,
or
they
is it-
exist, and I mean, you know, the issue always is in the easy and portable, you know,
right,
how easy, how portable.
right.
It's true.
And it would be, you know, it would be very nice to be able to do one a piece to different places. It might be possible to do one to a series of, a couple of stores that could share them. But, I mean, for me, that's, you know, once we get done with the menus and the new book, that's something I think I'm gonna be trying to move forward a little. And it gets into it makes sense, but it gets into a lot of legal
Right.
issues.
That's
We,
true.
you know, well, a good place to start, Michael, would be doing an inventory of, establishments that you think might benefit
Oh,
from a
yeah.
one-step ramp.
Well, I've already been talking to the places on Pleasant Street, what is it, the coffee
Oh, yes.
place, and the artist's gallery,
Yeah.
and,
You don't have to worry about the theater or the video store anymore.
That's gone.
yeah, well, that is true. But, you know, so those places seem at least amenable to
Okay,
trying something like this.
all right.
And I think some
Wasn't
of
there grants out there at one time?
We used to have CAN grants.
The CAN grants.
Community
Right.
access, and Northampton grants with CDBG funding, but that ran out.
Yeah,
We've
those
had
are,
that for 4 years.
Are there any grants out there for, because he has brought this up about.
Oh, yeah, no, we'll just see how it works and, you know.
I think some of the
We've
restaurants,
got, you know, if we've got $4,000,
Can't use it.
Now you can't use it.
I already checked on that.
you can't use it.
No.
We brought that up at the meeting, and that
Right.
is one of the items that
She
can be
brought that up.
purchased.
One of the problems is, and I would imagine the reason is because if you're actually enhancing the property of a particular establishment,
We're gonna have to do them all.
you would actually enhance its value as an establishment by providing them with a rent. That was the problem with the CAN grant,
Yes.
giving them door openers. We could do matching grants, as I recall.
Right, that's
They would say that, you know, if you come up with $2,400, we can give you $2,400 to build a ramp and do a door opener.
that'd be
Yeah,
cool,
that's
but
right.
that's some of the restaurants too, like people can't get in there.
Right, that's a.
Yeah, State Street did a really good job.
Right.
What if we utilize, that funds as matching money?
Right.
Well, I know that was worth investigating, to see if you can offer them as grants, so, because right now the $4,000, you have to do project specific, I would imagine, that.
Within that.
Right.
Within
But
that
if you
business.
can do, for instance, like Highland Valley Elder Services, and actually create a grant fund with that money, and I don't know the legality of that, so I wouldn't
Maybe
venture a
it's
guess.
something to talk to them about.
But it'd be worth investigating to see what you could do and actually offer grants again. But remember, we had a lot of trouble trying to get people to pick up the CAN grants.
I know,
Oh, yeah.
that's true.
That was,
That's so
yeah. We have money, we're saying we're gonna give you money.
Money.
Yeah, and usually it wasn't enough for them to even.
It's clear, it's a very expensive process.
Yeah.
Yeah.
It is.
pen's enough.
Yeah. Henry J. Reed at the town in the queue. I know your posse.
How you guys doing?
Michael, thanks for coming.
Peter, okay, what,
Good to see you guys.
do you know what happened to my mom about
I got a
getting the,
question.
one,
Where'd you
one
get
of
those
those,
t-shirts?
Florence Hardware Store.
the,
Right.
one of those things.
We made, I had these made up
My mom was gonna,
for the rehabilitation of the fountain and the park.
like,
It is
parking
at Trinity
sticker
Road.
or
You need a
something.
parking sticker or
That's what we're,
That's-
we got all the money.
Thank you.
That's, thank you, not parking sticker, but,
We've got
not
about
parking sticker, but,
$17,000
but,
right now.
something like,
$15 for the t-shirts.
like, but the souvenir.
We sold a lot of them.
My mom
A lot.
had, told
Yeah.
Peter, you're gonna
I'm
send
trying to
me
pick up
something,
some of those,
From Peter
you know,
Pocock, you said?
Northampton high school t-shirt,
or,
you know, just
or
some
you,
local
or
flavor for this.
We have these t-shirts
I don't
all
know,
over the
but
world.
I didn't get that.
Scotland, Ireland, Australia, New Zealand, we have
or
them in the
maybe you or
Philippines,
something, I don't know. My mom,
Alaska.
my mom said that you were gonna,
People, in the town have bought
send me something.
gads of them and sent them off to their relatives all around the world.
Not money, but like something.
I saw it.
I don't know.
It was on,
That's
on my
that's contact
Comcast internet
information, Tisha,
thing.
and you can
There
give
was
us
a
your mom,
little
she can
blurb
ask me
in
what
there on the
I-
homepage about a TV
Okay.
show
Okay,
that was,
Thank you.
you're welcome.
it was
Okay,
Beverly
so-
Hills 88 something. So I thought that was a good idea,
Alright,
and it was perfect. They sold like hotcakes.
okay, well, see if I can get one.
Okay, we did have
What's
Mary
that?
Claire Higgins, who was supposed to have been here.
Had
Can I ask, why are you here?
I'm just
And,
recording the meeting
she's the
Oh,
executive director
oh.
of Community Actions.
Alright,
And when I talked with her, she said definitely
say
the
good
state
stuff
was
about the
fine,
kid, yeah, this one.
so she's not here. We know we don't have any public comment. New business, I'd like to talk about, our agenda for the month of July. We will be having Carol Reinhardt, Sarah Weinberger, who's vice chair also of the Human Rights Commission, Natalie Munoz,
Luminous.
yeah, thank you, and
Emily Hodges, or any chance?
Georgiana Amato, also who's on the Human Rights Commission. And Emily, are you gonna be there?
I'm not sure yet.
And they're giving a report on quite a bit for that day. And then we have at 5:45, Daniel Lawson, that's how you pronounce it. He is the health inspector for the city of Northampton, and he's gonna be giving updates on, the health department itself.
Can I talk about that? Mary Medora contacted me, and the health department's kind of concerned, because they're actually now reporting to public safety. And they meet 4 times, and they just met on all the issues that they were reviewing, and they were wondering if they could get a pass from us, for not, wondering if they could give them this to showing up at the committee, for SSDA, because they said we just reported to a city committee the same things, and now, in fact, actually, public
Well,
safety.
Danny, I talked with him today, he was gung ho because Ben Wood went over this with him, of coming here to give us a report.
Okay, all right, yeah. Mary was concerned, so she.
No, you can let her know that,
Okay,
okay, because Ben Wood took care of it with Daniel. And
okay,
he's gonna give a report about, the updates on the health director, and also updates on the 212 activities of the health department, including any grants and projects, and updates on the Board of Health activities.